clavicular joint, you're going to palpate the clavicle, which is right here, and you're going to move medial. And then the little knob right here is the joint where it connects the clavicle to the sternum. And as her arm goes up, it's going to move in an inferior glide. And then as her arm moves back, it's going to move in a superior glide. And as the arm moves forward, it's going to move in a posterior glide. You have the clavicle, and as you palpate the clavicle and go medial, that's where the sternoclavicular joint is. And then as you move lateral, this is the shaft of the clavicle. And when you go lateral, this is the most lateral part. The acromioclavicular joint. You're going to follow the clavicle laterally. And you're going to go until you feel the clavicle end and a new bone begin, which is about going to be right here. And as her arm moves backwards, it's going to be an anterior roll. And as her arm moves forward, it's going to be a posterior roll. Follow the clavicle to the acromioclavicular joint. You're going to get to the acromion, which is about right here, and that is going to make up the roof of the shoulder. Follow the clavicle to the acromioclavicular joint to the acromion. You're going to move down and you're going to feel space, and then on the side you should be able to feel the head of the humerus. So as you found the head of the humerus, this is going to be the deltoid muscle. And as you follow the muscle, which ends in like a teardrop kind of, there's going to be the deltoid tubercle, which is where all the deltoid muscles attach. In the valley, you're going to follow the acromion down to the space and then over a little bit, and you should feel one bump, and that first bump is the greater tubercle, which the supraspinatus and teres minor attaches to, and then the groove is the bicipital groove, which the long head of the bicep attaches to, and the other bump is the more lateral bump is the lesser tubercle, which the subscapularis attaches to. Follow the clavicle over to the acromion, and you find this space, and you go over a little bit medial. You will find the coracoid, which is about right here, and that is where the short head of the bicep and pec minor attaches to. The spine of the scapula is going to be around here, and the trapezius and posterior deltoid are the muscles that attach. Once you find the spine of the scapula, directly above it, you should feel a little space, which is the supraspinous fossa, and that is where the supraspinatus muscle attaches to. And then below the spine of the scapula, you should feel another space, and right there is the infraspinatus fossa, which is where the infraspinatus and teres minor muscles attach. The medial border of the scapula is like right here. You can kind of see how it divots. This is the medial border, and that is where the rhombus muscle attaches to. And then if you keep palpating down, and you can kind of feel where the angle shifts, and it's about right here. That is the inferior angle of the scapula, which is where the latissimus dorsi attaches to. And if you keep following the inferior angle up with your fingers, you can feel the lateral border of the scapula, which is where the teres major and minor attach. After you find the inferior and lateral side of the scapula, then up and through the armpit, you can feel the subscapular fossa, which is a little space underneath, which is like where my thumb is, kind of. And that is where the subscapularis muscle attaches. Olecranon process, which as she bends her arm, it's the point right here. And if you palpate directly above that, you can feel a space. That is the olecranon fossa, and that the olecranon is where the tricep attaches to. Tricep muscle. The epicondyles of the humerus Over here is the medial, and over here is the lateral, and you can kind of feel them. They're like knobs. I can feel them pretty good on her. And the common extensor and flexor tendons attached to these points. The epicondyles of the humerus, if you go above those, you can kind of feel a ridge on both sides. That is the supracondyle ridge on the medial, which is this side, and the lateral, which is this side. This is where the lateral brachyradialis attaches to. So after you find the lateral epicondyle, if you go a little bit below that, you can feel kind of like a knob right here, and that is the head of the radius. Find the head of the radius, you palpate a little bit more down, and then you have them pronate, and you can feel it rotate over as they are pronating. Okay, next you want to palpate the ulna, which is on this side, the pinky side, and you go up to the epicondyle, and you can have them pronate, and you can feel the ulna stay stationary. After you follow the radius down, you can kind of feel a little bulb at the end, and that is the styloid process of the radius. And then you can feel, as you keep going down more, you can feel a little space, and then it drops to the scaphoid bone of the carpals. You follow the ulna, which is on the pinky side. You can feel a little knob. That is the styloid process of the ulna. And then there's a gap or space here, just like on the radial side. And then it drops off to the triangular fibrocartilage complex. If you follow the radius down to the styloid process of the radius and you go laterally, you can palpate and you can find a little knob. That is called the Lister's tubercle.